Do you have sharp pain underneath your kneecap when you jump or you squat or when you're going up the stairs? You may be dealing with jumper's knee, also known as patellar tendinitis. Hi, I am Dr. Sebastian.
And I'm Floyd. I'm the PA working here at Integrative Rehab Medicine.
Today we're going to talk about patellar tendinitis. We're going to talk about what it is, how to diagnose it, what are the symptoms, and best of all, how to treat it. So what is patellar tendinitis?
So right here we have a model of the knee. So you have your patellar tendon, and your patellar tendon is going to attach your kneecap to your shin bone here, and it's going to help to extend your knee. So a lot of people, when they do overuse injuries, repetitive injuries, this can lead to
squatting,
inflammation in this patellar tendon. And if that inflammation goes on for long enough, what can happen is you can actually get degeneration or small micro tears in the tendon itself.
Floyd, so what are the best ways to diagnose patellar tendinitis?
So the way that we're going to diagnose patellar tendinitis, we're going to do a physical exam, so you can push on that area and see if it's painful. You can also do an ultrasound and you can see if there's swelling and inflammation in the tendon itself. Sometimes you can get an MRI if we're more concerned for more significant degeneration.
So there are a lot of treatments for patellar tendinitis. The standard of care is taking anti-inflammatory medications such as ibuprofen or Advil, which we typically don't recommend because they come with side effects. The one thing you really need to avoid completely is getting a steroid injection in the patellar tendon, because that can actually cause a tear of the patellar tendon and cause catastrophic side effects. What we recommend in our clinic is regenerative medicine, things like prolotherapy, PRP, or sometimes even bone marrow stem cells. So what are these regenerative treatments?
So prolotherapy are going to be injections with dextrose. Dextrose is a type of sugar water, and what it does is it causes some inflammation, and then the body can heal from that, and it can actually make these tissues healthier over time and stronger. When there's more significant degeneration or more significant amounts of inflammation, we can use PRP. PRP is platelet-rich plasma, so we can take your own blood, and we have a lab here in our office, and we can process that blood, and we can use that for the injections. When we're doing these treatments, we're also treating the other structures of the knee. It's typically not just the patellar tendon. We're treating the MCL, the LCL, the meniscus on either side, around the kneecap, and then the patellar tendon. So these are all part of comprehensive treatments. When people have really severe degenerative changes and the patellar tendon is involved, like someone with severe osteoarthritis, we can use the bone marrow stem cells as well.
So as Floyd said, it's typically not just the patellar tendon. There's other things that are involved. Very often we find people have some weakness of their muscles, the quadricep muscles or hip muscles, and there's some other alignment issues that can put an extra stress onto that patellar tendon, which can lead to patellar tendinitis. So the best way to treat it is doing a regenerative medicine treatment like prolotherapy or PRP that is combined with physical therapy, postural adjustment, sometimes evaluating shoes and seeing if anybody needs inserts. So if you're interested in finding out more about patellar tendinitis or runner's knee, click the link below, check out our website, or give our clinic a call.